Sure. Well, good morning, everyone, and welcome to City Council Chambers. Our jobs are pretty cool on some days, but on days like today, it's really exciting because together, working with partners in our city, working with the mayor, through the exceptional leadership of my colleague, President Pro Tem Robert Dorans, we have some really, really amazing news to share with our residents today. There is a shared experience that every working class family in our city has experienced, especially if you're a parent. It's a Tuesday night or a Sunday and a child has a fever or is throwing up. Mom and dad know that they should take their child to the ER. They think it's covered, but the last time this happened, they ended up with a huge bill. So they drive up and they sit in the car waiting to see if that fever breaks or if the child gets worse, to see if they'll have to risk it. In any hospital parking lot, you'll see the cars of families just waiting it out, torn between their desire to heal their child and their fear of getting another bill that they know they can't pay. Medical debt is the leading cause of bankruptcy in this country. It is a byproduct of an American healthcare system that is confusing at best and different at worst, but fundamentally driven by payers, not patients and providers. You can do everything right, get a good job, get health insurance, and then get hit by a car, or experience pregnancy complications. And now suddenly you are plunged into a world of unpaid deductibles, insurance appeals, and collection costs. But medical debt is more than just a financial liability impacting your credit report. It makes people put off the care that they need, because an unexpected copay or out-of-network charge could be scarier than the test results they know they need. And after a patient or family gets that red letter, at a time when we want them to be focused on feeling better, instead they're dealing with a new anxiety. So, for the last year, City Council has been working with our partners, with the mayor's office, and with our amazing, amazing regional hospital system to see how we can ease this burden on all of our residents. So today, I'm thrilled to announce that we have found a solution. Hundreds of thousands of Columbus residents are about to get some very, very good news. With that, I'm going to turn it over to my good friend, the Council President Pro Tem of City Council, Rob Dorans.
Well, good morning, everyone. And thank you, Council President Hardin, Mayor Ginther. Appreciate you being here this morning. We've certainly had the pleasure, as Council President mentioned a moment ago, working over the last year with our Central Hospital Council and their members. The collaborative relationship that has existed between Mount Carmel Health Systems, Nationwide Children's Hospital, the Ohio State Wexner Medical Center, and OhioHealth have allowed us to be here this morning to share with you a unique Columbus solution to the problem that Council President just laid out. I also want to pause and certainly thank former Council President Pro Tem Elizabeth Brown, who's now the CEO of the YWCA here in Columbus, who started this conversation a little over a year ago. Also want to thank our council staff who made this possible, including Matt Erickson and Kirsten Destosi from our Legislative Research Office, and certainly my team, Kevin McCain and Andy McDonald, for getting us here today. You know, part of building a more equitable city is about removing barriers that exist. And medical debt is one of those barriers that can hit a family, as the Council President said, any time, even with the best of planning. As we've talked about, medical debt is the leading cause of bankruptcy in this country. Families should not have to choose between putting food on the table and accessing needed medical care. My own family knows this story as well. When I was born, a few days afterwards, my dad and his fellow union members went out on strike. I was born on a Saturday and they were on the picket line on a Monday. And for months afterwards, they would go to the mailbox wondering if they were about to have a bill from our hospital stay that would severely financially impact our family for years to come. That story we know exists for so many here in Columbus on every single day that happens in our community. And while Columbus City Council doesn't have the power to restructure America's healthcare system, what we're announcing here today will increase economic stability for working families that have been saddled with medical debt for far too long. Tonight, my council colleagues and I will vote to enter into an agreement with the Central Ohio Hospital Council for an amount of up to $500,000 for administrative costs related to the forgiveness of medical debt for Columbus residents. This partnership will provide $335 million in debt forgiveness for Columbus residents who were treated at any of the 4 hospital systems between 2015 and 2020. To be eligible, a patient must have an income at or below 400% of the federal poverty level. That's an annual income of $55,000 for an individual and $111,000 for a family of 4. Our estimates tell us that these efforts will result in over 340,000 Columbus residents having their medical debt relieved under this program. The average debt that will be relieved on this program will be around $1,000. Starting this week, eligible residents will receive notification by mail. No action is needed on the part of our residents. The letter will reveal the total amount of debt that will be forgiven, and it is my hope and my council colleagues' hopes that our efforts will directly improve families' physical, mental, and emotional health, in addition to increasing their economic stability moving forward. We know that medical debt disproportionately affects women, people of color, and households that are earning less than 400% of the federal poverty level. Broadly, Columbus City Council hopes that this debt relief will advance economic opportunities for impacted residents and reduce social inequities for those impacted by these types of debts. No one in our community should forego medical care due to an inability to pay or concerns about that outstanding debt. And again, I want to thank so many folks that have worked on this for the last year, and certainly our hospital partners and certainly the hospital council who have really tried to find a unique way to not only forgive this debt, but really to establish a way that we are touching more individuals in our community. And I think that is something that is unique to what we've done here in Columbus when we're talking about $335 million and over 340,000 residents. That's an incredible amount of residents in our city, and it's certainly an incredible amount of debt that will be lifted from families' heads moving forward. And with that, I'd love to introduce Mayor Andrew Ginther to talk about more of the economic impact that this will have for families right here in Columbus. Mayor, thank you.
Do you want me to introduce Jeff, or are you going to?
I'm going to.
Okay, great. Thank you, President Pro Tem Dorans. Good morning. What a great morning here in the city of Columbus. Just grateful for President Pro Tem Dorans' leadership, the due diligence, the hard work, working away, and our health systems. I think today's another great example of the Columbus way. You know, the business community, our health systems, government working together to put our families first in this community. It's pretty stunning when you think about it. Literally a third of our neighbors, over a third of our neighbors, are going to receive significant economic help through this partnership and the ability to focus on what's important, the most important, and that is the health and well-being of their families. So I just am grateful for the council president, President Pro Tem Dorans, Jeff, and the health systems for their partnership and work around this effort. We know medical debt is a significant problem and barrier for many families around this community in the country, impacting both the insured and uninsured alike. It's an imposing barrier is making ends meet and achieving a better quality of life when those who are saddled with debt are forced to choose between making rent, their debts, and other obligations for the family. It has a devastating effect on the health and well-being, keeping folks from seeking the care they need when they really need it. And it drags down savings and credit scores more than credit card debt, utilities, and auto loans combined. And as you might expect, these effects are unevenly distributed across society. Women, African American and Hispanic adults, the uninsured, parents, and those with lower incomes are considerably more likely to report having medical debt weighing them down. No one should have to face the stress or specter of financial ruin just to get the medical care they need to lead happy, healthy, and fulfilling lives. No one should have to despair simply because they went to the doctor or sought treatment at a hospital. And no one should have to abandon their hopes and dreams personally or professionally because medical debt has precluded the possibility of upward mobility. Today, our community is proud to take on this issue, wiping out medical debt to the tune of $335 million among 340,000 of our neighbors. This averages out to just under $1,000 in debt forgiveness for each eligible resident. Forgiving this debt will go a long way toward helping our fellow neighbors rebuild their savings, pay off their bills, qualify for a future loan, make a down payment on a new car, or support our local businesses. None of this would be possible without the partnership and collaboration that has come to embody our community's can-do spirit, the Columbus way, because we do collaboration and cooperation better here than anywhere else in America. To the innovation, compassion, and strength of our four big health systems here in the region. To the united front we form between the administration and council to see this work through. It takes all of us stepping up and pitching in to make big things happen, and it is worth every effort. Today, I'm reminded as we make this announcement of the Recovery and Resiliency Advisory Committee. We came together in the throes of the pandemic saying we wanted our recovery to be dynamic and inclusive, different than the recovery that came out of the Great Recession. Today's announcement is completely in line with the recommendations of the Recovery and Resiliency Advisory Committee. We want everyone to share in the recovery. And we know the families and our neighbors that are going to be helped by this are going to be critically important to this community's future. I also think of our equity agenda, Opportunity Rising, wanting to make sure that every family in every neighborhood is sharing in our success. Medical debt has been a crushing barrier for so many families here and around the country. And today's announcement is another step forward with our equity agenda. Together, we'll continue to empower individuals and families across Columbus while laying the foundation for a brighter and more prosperous future for each and every one of our residents. I'm excited because of the work of the health systems and President Pro Tem Dorans. We might be building a national model, the Columbus way locally, based on what's most needed in our community. This is different than what you've seen in other cities around the country because we took the time and Council President Pro Tem Dorans did the work with our systems to make sure this was the right model for Columbus. So with that, I'll turn things back over to President Pro Tem Dorans. Thank you.
Thank you, Mayor. And as the mayor just mentioned, one of the unique aspects to what we're here announcing today is that level of collaboration between the city and our hospital systems here in Central Ohio. And the gentleman I'm going to ask to come speak here in a moment, we would not be here without. And I think to him and certainly everyone from his team and all the hospital systems for digging into this, because anytime we start talking about debt, anytime you start talking about billing, I think I learned an incredible amount engaging in this process. From our hospital systems about how we could develop something that would go far broader and far deeper for our residents. And without their work to join us in this, we would not be here this morning. So with that, I'd love to introduce Jeff Kingler, President and CEO of the Central Ohio Hospital Council, to speak about his members' commitments to this program. Thank you.
Good morning. Thank you so much to Council President Hardin, President Pro Tem Dorans, Mayor Ginther for inviting me to speak today on behalf of the 4 hospital systems. So on behalf of those systems, we do want to express our appreciation to you all for your leadership and your partnership in addressing this important issue. I also want to reiterate the appreciation to the 4 hospital systems for your collaboration on this work. Our hospitals understand the financial burden that medical bills can place on our patients, and we're committed to providing financial assistance programs that help our patients with their medical bills. Our hospitals have and will continue to care for all Central Ohio residents, regardless of their ability to pay. As the mayor mentioned, Councilman Dorans mentioned, through this initiative, our hospital systems are notifying more than 340,000 Columbus residents who received care between 2015 and 2020 and are unable to pay their medical bill that their outstanding medical debt has been forgiven. Residents who are eligible for the program will be receiving a letter in the mail. In total, our hospitals are writing off more than $335 million in outstanding medical debt. And again, I appreciate the hospital systems coming together to design a program that provides this debt forgiveness in a consistent way, regardless of the hospital where the patients received their care. Our hospitals really have a long-standing tradition of working together to address patient financial assistance. Going back to 2007, the 4 systems came together to develop a common standard in the way they provide free or discounted care to patients who receive care at their facilities. Under these standards, again, that were adopted back in 2007, all Franklin County hospitals provide free medically necessary care for patients with family incomes below $55,500 for a family of 4. Patients in that income bracket who receive care at a Franklin County hospital do not receive a bill. Patients with family incomes below $111,000 for a family of 4 are provided significant discounts for the care they receive at any Franklin County hospital. So why is this important? Unlike other communities, according to our research, Central Ohio is the only community in the United States where all hospitals in this community follow the same income thresholds for providing free and discounted care. Other large cities across the country have designated hospitals that provide the bulk of free care to the residents of that community. These hospitals are typically supported through increased property taxes. Unlike those communities, Columbus hospitals have come together and they share the responsibility of providing care to patients, provide care to all members of their community, regardless of their ability to pay, with no tax on property owners. The amount of free care that our hospitals provide to patients is significant. From 2015 through 2020, Franklin County hospitals have provided almost $900 million in free care to patients. Combined with the medical debt forgiveness program that we're being announced this morning, the 4 Franklin County hospital systems have provided more than $1.3 billion in uncompensated care to Franklin County residents from 2015 through 2020. Our hospitals are committed to assisting patients enroll in the Medicaid program and sign up for financial assistance. However, there will be and there will continue to be Central Ohio residents who fall outside of the eligibility criteria for these programs, and they'll struggle to pay for their outstanding medical bills. Patients who need assistance in paying their medical bills really are encouraged to work with their hospitals to identify whether they are eligible for these programs, or for those patients that fall outside of those income eligibilities, there are other avenues they can use to work with their hospitals. All of our hospitals have financial assistance counselors available to work with patients, and all of our hospitals will work with patients who struggle with medical bills with long-term payment plans at no interest or very low interest. Again, so we really encourage residents that if you struggle with your medical bills going forward, reach out to your hospitals, work with your hospitals, and there are solutions available. As the mayor mentioned, Councilman Dorans mentions, it's really important to stress that no Central Ohio resident should ever delay or forego care due to an outstanding payment. Our hospitals have and will continue to provide care to all Central Ohio residents regardless of their ability to pay. So again, I thank you for the opportunity to speak this morning. And again, I want to extend the hospital's appreciation to our elected officials in partnering with us on this important program. So thank you very much.
Well, again, want to end the way that the council president started. It is rare for us to stand up on a Monday morning and have such good news to communicate to almost a third of Columbus residents, to think about the burden that's been hanging over those families potentially for years, in which we're going to pass legislation tonight at Columbus City Council that will remove that burden. So it is an exciting day in Columbus, and certainly an exciting day at the mailbox for hundreds of thousands of residents over the next several weeks as they find out that that burden hanging over their head will finally go away. And all the things we've talked about here today, that their families can continue to seek the medical care that they need without any concern about what that old bill may or may not mean for them. With that, certainly want to thank everyone for being here this morning. Told we have 225 down the hall set up for one-on-one interviews, and with either any of the folks who have spoken here this morning. So thank you for being here this morning. Have a great day.